Hello everyone, welcome back to Sedok Health, a platform where you get to ask all those biting questions concerning your health and you are duly answered. We are trying to bridge the gap between the doctor and the patient by giving you the best medical knowledge so that you can make wiser decisions concerning your health. As usual, a lot of questions came in. We have listened to you and we are here to answer those questions. Today we talk about fibroids. What exactly fibroids are, and then how will someone know that they have fibroids, the risk factors and the causes of fibroids, the treatment, the prevention of fibroids, and finally the complications of fibroids.
You ought to know your health.
Welcome back to Sedok Health. Today my colleague Dr. Dan Sechiunga will help us understand exactly what fibroids are.
Fibroids are non-cancerous tumors of the uterus. Tumors means swelling. The uterus is divided into 3 layers. It has the inner layer, which a woman sheds every month, called the endometrium. It has the middle muscle layer, and it has the outer coating of the uterus. The fibroid can grow in any of those 3 layers. When a fibroid goes in the inner layer, it is called a submucosal fibroid. When it grows in the muscle layer, it is called an intramural fibroid, and when it grows in the outside layer, it's called a subserosal fibroid. So like I've described them, these are small swellings that grow in any part of your uterus.
So Dr. Dan, now that we know what fibroids are, how does someone know that they actually have fibroids?
Often at times, most women will not have symptoms of fibroids. This will be discovered as a coincidental finding, maybe on a routine pelvic ultrasound scan. Let's say a woman is going for her antenatal screen, then she finds out she has uterine fibroids. However, other symptoms of fibroids may include heavy menstrual bleeding, bleeding that exceeds more than 7 days, painful periods, feeling of a lump or a mass within the lower abdomen called the pelvis. Sometimes, if it compresses the rectum, you may have constipation. If it compresses against the bladder, you may have painful urination. Uterine fibroids can also present with a very large swelling of the abdomen. I have seen a woman who presented to the clinic with a very swollen tummy, and most people had thought she was pregnant. Yet it was because of a fibroid. So fibroid can present with a large swelling of the tummy. As we know, fibroids range from small sizes as seedlings to larger masses.
And then, what are the likely risk factors and causes of fibroids?
Risk factors for having fibroids include starting periods at an early age or finishing periods at a later age when you're entering menopause. Genetics also plays a big role in development of fibroids. So there's a family correlation in fibroids. If your sister or mother had fibroids, the chances of you having fibroids also increases. Other risk factors for having fibroids include obesity, include vitamin D deficiency, include excessive alcohol intake, include a diet that has less of vitamins and green vegetables, a diet that has a lot of red meat. As we shall see later, these are things we need to work on so as to prevent fibroids. So the causes of fibroids are really unknown. However, the theories that have been put in place to describe why someone would have fibroids and another person may not have fibroids. Hormones, estrogen and progesterone that help a female go into her normal regular periods are associated with an increased chances of having fibroids. And this is why we see fibroids after puberty, and rarely do we see them after menopause. So they are majorly seen in the reproductive age of a female. So having an excess of these hormones puts a woman at an increased risk of having fibroids. Getting pregnant at a later age puts a woman at a risk of having fibroids. Or women who never get pregnant at all puts them at a risk of having fibroids. And the reason behind this is because once a woman is pregnant, she has at least a 9-month break from these hormones. For diseases like obesity will cause your body to produce more estrogen than normal, and this will eventually cause you to have more likelihood of having fibroids.
Now that we have looked at the risk factors and causes of fibroids, Now let us understand the treatment for fibroids and finally the prevention of fibroids.
So treatment of fibroids varies from one person to the other. As we have seen, most fibroids will stay in a female without causing her symptoms. Once a woman starts getting symptoms of fibroids, it probably needs treatment. So the treatment of fibroids will range from watchful waiting to invasive treatments. For women who have discovered they have fibroids coincidentally and have no symptoms, they do not have to do anything about their fibroids as they don't cause any problems. However, they can have serious scans done on a regular basis to see if the fibroid is increasing in size. So watchful waiting is the first line treatment of fibroids. There are drugs that we can give a woman who has symptoms like excessive bleeding associated with fibroids. These include drugs like ibuprofen, drugs like contraceptive pills, the normal birth control pills. An intrauterine device that produces hormone progesterone can also be used to reduce bleeding in a female who has excessive bleeding associated with fibroids. These, however, do not treat fibroids or do not even shrink the fibroid. They will basically help a female reduce her bleeding. If you have not watched our video on excessive menstrual bleeding and its treatment, check it out in the link up here. There are other hormonal drugs that can be used to treat fibroids. These drugs work by reducing the levels of your estrogen and progesterone in your body. Some of the examples of these drugs include Zoladex. These will help in reducing the size of the fibroid and also reduce bleeding associated with fibroids. Often at times, a doctor will give this medication 3 months prior to surgery so that a surgeon may not have excessive bleeding during the operation. As I've told you, I've seen a woman who had a fibroid that was as big as a pregnant woman who is 9 months pregnant. We had to give this woman this drug 3 months prior to the surgery. The good news is that during the surgery she did not bleed a lot and eventually she had this surgery done successfully. It was very good news as this woman had been told she would die if she had this surgery done on her. So as I've hinted, the other management of fibroids is surgical management. Commonest surgical management of fibroids is what we call myomectomy. Myomectomy means a fibroid is removed out of the uterus and the uterus is spared. So for women who have never had children and have fibroids, this is the best option of management. So this surgery can be done through an abdominal surgery or it can be done through minimally invasive surgery, we call laparoscopic surgery, where a camera is introduced into your abdomen through 3 tiny holes in your belly. Fibroids can also be removed through what we call hysteroscopic myomectomy. During this procedure, a camera is inserted through your cervix, that door into your uterus. So in the process of viewing these fibroids, they can be resected. Other surgical operations for treatment of fibroid include removing of the uterus, what we call hysterectomy. This is a last resort in treatment of fibroids as it will take away the woman's womb. This is only considered if a female has had children before and has no fertility desires. In the same line, the blood vessels supplying blood to the uterus can also be blocked. This will also stop a woman from having children at all. So among the preventive measures of fibroids include reduction of body weight, as we have seen. Obesity is a large risk factor for fibroids. Having a diet that has a lot of greens and vegetables is very important in prevention against fibroids. Avoiding red meat is also very key in prevention against fibroids.
So Dr. Dan, in case someone has fibroids, what are the likely complications that will arise when the fibroids are not treated?
So complications of fibroids include failure to conceive. This is not a very common complication as very many females with fibroids eventually conceive. However, if a fibroid is sitting at the entrance of the fallopian tubes into the uterus, a woman may have difficulty conceiving. Or a fibroid can also cause infertility if it's blocking the entrance into the cervix. Remember, the cervix is the door into your uterus. Once it is blocked, sperm will be unable to enter into the womb. If you have not watched our video on how fibroids can cause infertility and other causes of infertility, check out the video screened above here. Other complications of fibroids may include recurrent pregnancy loss, especially for fibroids that are found within the inside of your womb, where the baby is supposed to grow from. However, the commonest complication of fibroids is excessive bleeding during periods. If this is left untreated, it can cause severe anemia, which is low blood counts. In a nutshell, fibroids are non-cancerous tumors of the womb that start from puberty until menopause. They can cause severe symptoms such as bleeding, which can cause low blood counts, medically known as anemia. Treatment could be watchful waiting, medical or surgical management. Prevention is majorly lifestyle modification.
Thank you once again. Remember to like this video, share it with your friends and colleagues. Subscribe to the channel, click that bell icon so that you are always notified when we upload a new video. Sedok Health. Ask the